I'm really excited about this, actually. Oh, this meeting is recorded. Really excited about this because I have got with me our very own Dr. Robin Chisman, who's going to talk to us about himself. There's so much you guys don't know about him, it's real. And then he's going to talk to us about the role he's doing within peer as a peer health fellow. And you may or may not know, he's our very first one. So he's our pioneer, our guinea pig, our innovator, whatever you want to describe him as. He's your man. But Robin, lovely to have you. I know how busy you are, so really appreciate you being here. How are you?
Pleasure to be here. I'm very good, thanks. Yeah.
Awesome.
Looking forward to this.
Me too. It's been a long time coming. Listen, to start us off, why don't you tell us a little bit about yourself and why you even chose to work within medicine? Because I'm quite keen to know that. So over to you.
Okay, yeah. So hello, everybody. My name is Rob Chisman. I'm a GP. I work at Tudor Lodge Surgery as one of the salaried GPs there. And I also work as the Sustainability Fellow at Peer Health. So that's me. I have been a doctor for 8 years, I think, in total. And I initially trained in Birmingham University on the postgraduate medicine course, and that was in about 2011. And I decided to do that probably a little bit later than some people do, after I was initially doing a degree in genetics and working in kind of biochemical research. I was very interested in kind of bacteria and cell signaling and very geeky science bits. And was really enjoying that. But at the same time, I thought I quite like talking to different people, and I wasn't really getting as good an opportunity to potentially do that within the kind of scientific research area. So decided to have a look around and see what other things were going on and see what other people were doing, and saw that medicine was potentially an option. So I applied for medicine and got in on that on the postgraduate degree at Birmingham, and that's kind of led me to where we are at the moment. So that was quite a number of years ago. I've ended up doing a lot of things since then. Did GP training locally around Bristol. Part of that was working in Western. Really enjoyed working in Western. So have stayed here and now working on this.
Awesome. And what made you decide to actually read medicine in the first place?
So when I was initially thinking about what I was going to do at school, I never ever remember thinking about medicine. I went to a comprehensive school. Not many people did medicine from my school, and I never gave it a single thought. And then I was really liked doing science, and thought, I'll did biology and chemistry A level. I'll go and do biochemistry. So I went and did that and really enjoyed it. But I didn't know anything about medicine. I suppose I was quite fortunate that I didn't really have many interactions with hospitals and things like that growing up as a child. So I had no idea about it. But it was only when I started to think in my first degree on genetics, about the applied use of some of the things which we were studying, that I started to think, oh, well, what is it that they're doing with these things that we're learning about? And so I kind of started to step into that realm, and I did a volunteering in Northwest London. It was a hospice, and my kind of role there was just to go and talk to people as a volunteer and make cups of tea. But it was really enjoyable, just learning about different people and their experiences, and everybody was really kind. And there was just a very nice atmosphere, and I thought, this is great. I feel like I can talk to people. I can, maybe make people a bit happier. So that was the whole reason for going into it at that time. And after that, kind of learning all the different areas of medicine was it was really interesting. I found it fascinating learning all about all the different branches of medicine. And that's probably why I've ended up in GP, because it's an area which you see lots of different areas. You're talking to people all the time. You're trying to make a difference, but you're also getting a really good generalist approach. You have to be kind of fairly good at a lot of things. So that's why I've ended up here, I guess. Yeah.
Brilliant. It's fascinating to hear. Actually, you didn't go straight into medicine. There's other stuff that you did before you went in there, because normally I think most people assume that anyone that thinks of medicine goes straight in, and it's just fascinating also to hear that when you were growing up, you didn't even think about medicine. So if there's any youngsters out there that are watching us, that's something that you just need to bear in mind, that Dr. Chisman's an example of. It doesn't have to be, it can come later. So that's that's quite an interesting one. What is really cool though is you're our first GP fellow at Peer. Does it bother you? Does it worry you? Because it's quite tough, right? You're the first one.
Yeah. No, not at all. Actually, I've found it's been really enjoyable. So I qualified last year at the end of my GP training, and I heard about the fellowship. I actually heard about the fellowship when I was working as a registrar at Tudor Lodge, so one of the peer health practices, and I saw one of the kind of leaflets that was about it, and they said that one of the possible areas that you could do a fellowship in within sustainability. So sustainability is about trying to improve people's health outcomes, trying to improve how healthy they are, whilst reducing the impact which we have as doctors and as patients, as people on the planet. And it was an area which I've been really interested in recently. So I thought this sounds an amazing opportunity, because I'm enjoying working in Western, and now they're offering a particular kind of project within the area which I'm really interested in. So I found it to be a great opportunity. Unfortunately, there was some things which just kind of fell at the right time. So at the time there was this particular kind of idea which came from the government, which was to try and increase kind of particular sustainability domains, specifically within inhalers, and that was that was brand new from 2022 to 2023. So it was an area which, because it was new and because I was interested, I thought we could make a really big difference in. So in terms of being scary, I didn't think it was, because fortunately it was an area which is just starting to be funded and be of interest to everyone. So I thought, this would be a great way that I could make an impact, a positive impact for peer and for the patients within Western. So it's just been great from then, and then working now on different projects to try and increase the amount of kind of sustainable practice that we have locally.
Well, there's not a lot of carbon footprint in health, is there?
There's not a lot of carbon footprint
in health, is there?
In health?
Yeah.
Unfortunately, that's not quite true. So it depends on what you read, but globally, the carbon footprint for healthcare is estimated to be about 4% of the whole of the planetary carbon footprint. So it's quite significant. In the UK, that's probably slightly less, but the whole carbon footprint of the NHS is absolutely massive. Even if you were just to take the kind of travel of patients and staff to and from hospitals and GP practices and things like this, then it's huge. Primary care is about 20, it's about a quarter of the carbon footprint of the NHS. So it's quite significant by itself. And then within that, there's definitely different areas which have a very high carbon footprint. And it's not just about carbon footprint. Obviously, as doctors and as all clinicians, our main concern is about the patients that are in front of us. And so it's just about trying to do things which are good, if not better, for patients in front of us, whilst trying to do things in maybe a slightly altered way, so that we can reduce the impact that we have on the planet. And there's some really good examples of where that can work really hand in hand. And many people won't think of them as being particularly kind of low carbon or sustainable. But I think, for example, arming people with the knowledge to manage conditions which they otherwise wouldn't have felt confident to do themselves, for example, in asthma or eczema, and knowing how to manage those really well is a low carbon solution. Because if that person then doesn't become unwell as a result of that, they then won't be coming to see me, they won't be getting admitted to hospital, for example. So actually managing people well and treating them well and getting them healthier is the best outcome. So if we can do that, then we're winning. So they're usually they work well together. There's certain areas where we could just do small tweaks, do things in a slightly different way, and make a really big impact. And that's some of the things which I've been looking at. Those really kind of things which we can make, which are maybe kind of low-lying fruit, which we can just say, if we just did this just slightly differently, then we can make a big impact. So those are the kind of areas that you can do big things, we can do little things. But all of it can be really helpful for the environment and for patients.
It's an interesting way of looking at it in terms of treating patients well, isn't it? Because sometimes I think we go straight to the big things. But talking about big and little things, since you've been a fellow, you have done an amazing piece of work within the organisation. So why don't you talk to us a little bit about some of the stuff you've done and the outcomes that we're seeing and what you're hoping to do in the near future as well?
Yeah, sure. I'm really happy to talk about that. So one of the biggest areas of focus I've had since being the sustainability fellow up here is to do with respiratory care. So particularly respiratory care is a particularly high carbon impact area within primary care. The reason for that is to do with how we manage kind of asthma and COPD, which is kind of smoking related, usually illness. And it's to do with the number of inhalers which we prescribe for this. And what people hopefully know now, because we should be telling everyone, is that inhalers come with quite a high carbon footprint. At least some of them do. And those inhalers are ones which obviously people really need for their respiratory conditions. But it's a question of which inhalers we use and how we get rid of them, which I suppose is more important for me. To make sure that we're using the right inhaler for the right patient, and to make sure that they know how to properly dispose of them. So my project has been looking at both the type of inhaler which we're using and kind of working with all the different practices to try and think about a lower carbon inhaler, and also making sure that we are disposing of inhalers appropriately. And I've been really fortunate to get kind of some grant money from Healthier Future Action Fund, which is kind of an NHS green fund, in order to work with the different practices and work with also some local groups, visited some schools and things like this to try and get people to return their inhalers back to their pharmacy. I was working with the 20 different pharmacies around Western, up to kind of Winscombe, Boundwell to Whirl, and trying to engage with the pharmacists to try and get patients to start thinking about it when they're receiving their inhalers, that actually that bringing them back is really important. And why is it important, and what are we doing it for? So it was trying a real community kind of project that we were trying to do. And as a result of that, we saw inhalers, kind of returns of inhalers back to pharmacies increase quite substantially. So that's been really pleasing. And it's quite a simple thing, that just to try and bring inhalers back to pharmacies. So it's just one example of like a small little tweak that we can make, which has quite an impact.
That's fascinating. That's amazing. It goes to show small things make a big difference. I never did ask you about where your passion for sustainability came from, because you're really passionate about this area, and we can tell by all the things that you have done and are continuing to do within the organization. But it must have started from somewhere, right? In terms of your passion, where did it derive from?
I'm not sure exactly. I think, like everybody, I care about the environment. You know, anybody who's who likes the environment which we live in thinks that it's important. People, I think some people get that from, you know, their parents growing up, from going out on long walks, things like this. For me, I think it was a question maybe of the science. So I initially did like a science degree, and we've had kind of scientists telling us now since the 80s that climate change is happening, and that it could, this climate chaos really, that we're now, you know, seeing evidence of, is really going to be impactful for us. And I think what maybe a lot of doctors probably are just starting to kind of wake up to a little bit is that the impact this is going to have on patients around the world, but in the UK as well, with kind of more extremes in terms of temperature, more extremes in terms of just weather events. And that will have an impact on us. It'll have an impact in terms of what we see coming through the door. And I think that change is just going to be kind of increasing coming in the years ahead. It will certainly be very impactful for people across the world who, unfortunately, obviously, you know, we have a significant advantage in the UK, a relatively rich nation. We might be able to put in some changes to us to try and accommodate for these temperature changes and these weather patterns. But in other areas of the world, that's not going to be possible. So I think the impact is huge. So for me, that passion has just come from the science, really. And I think that's been clear for quite some time. But the effects of it maybe are becoming more and more clear to everyone around the world now, in terms of its effects on us on a kind of year-on-year basis.
Honestly, Dr. Chisman, I could talk to you forever about your fellowship area, sustainability. But before we go, really would be interested to know what advice you'd give to anybody from any practice across the UK who are thinking about their footprint and sustainability, and then any advice that you could give to anyone who is thinking of perhaps maybe coming out of med school, thinking of what to do, thinking of fellowships. So if you could just dish some advice to both, that would be amazing.
Yeah. So anybody who's who works within kind of medicine, who's thinking about sustainability, there's some great resources available. There'll often be somebody who's involved in kind of green things within any kind of organization, sustainability people. But there's some great websites that you can go and have a look at. So Greener Practice is one of them. Also Green Impact for health. That's a really good one. And they offer just really good practical bits of advice which you can go through to try and improve your organization's environmental credentials. But anybody who's thinking about getting involved in a fellowship like the Peer Health Fellowship, I would really encourage. It doesn't have to be about sustainability. It could be about anything that you're really passionate about. So for me, it was about sustainability, but for you, it might be about something completely different. And I think what this space has allowed me is just to get involved in something which I really like to spend time on, which I think is good for patients and good for all of us. As clinicians, it just improves people's health, which is great. So I think anybody who's interested in doing a project on a particular area, then thinking about doing the peer fellowship, I would really advise.
Awesome. Thank you so much. We appreciate you being the first in terms of our peer health fellows, and also the fact that you're pioneering so many new things for us here at Peer. We appreciate you, and we thank you so much for your time. I know how precious it is, but come and talk to us again soon when you've been in the fellowship role for much longer, and tell us a bit about all the things you're doing. But we really appreciate you. Thank you for coming to talk to us today.
Thank you, Brandie. It'd be nice to speak with you.